My name is Bianca. I'll be your student nurse for today, and I'll be going over how to check your blood sugar at home. With your new diagnosis of diabetes type 1, it's very important that we're checking your blood sugar throughout the day. Now, your provider will prescribe to you how often and when to check your blood sugar at home, but typically it's anywhere from 1 to 3 times a day before meals. Now, your provider will also give you a set range of where they would like your blood sugar to be at. A reading below this range or above this range could result in either low blood sugar or high blood sugar. Anything outside of the range may prompt you to calling your provider. Now, before we get started, we're going to need some supplies in obtaining your blood sugar. We'll need a Accu-Check machine, some test strips, alcohol pads, lancets, these are what contains the needle to poke the finger, and some gauze pads. So once we have all of our supplies, we'll go ahead and get started in how to obtain your blood sugar. Now these supplies can be found anywhere from Walmart to Publix, Walgreens, or CVS. So first step, we're gonna go ahead and wash our hands. It's very important that you wash your hands to make sure there's no debris of dirt or sugar left over on your hands that would lead to an inaccurate reading of your blood sugar. Once you're done cleaning your hands, step 2 would be getting your Accu-Check and turning it on to where it prompts you for your test strip. Every Accu-Check is different, but it will eventually guide you to insert your test strip. This specific test strip shows the arrows in how to insert the test strip into the machine. So we're going to go ahead and insert it upward like it directs, and it'll eventually get to a point where you can't push it further back and you'll be left with a white strip like so. It's very important that we do not touch this, as it could as well contaminate the sample. So once that is ready, we're going to go ahead and take our alcohol swab and pick from any of these 3 fingers: your index finger, middle finger, or ring finger. Third step is going to be cleaning the chosen finger. I'll choose the index finger, and we're going to go ahead and poke at the very tip on the side. I'm going to take my alcohol pad and clean it up very well. Now, using the lancet, step 4 is going to be poking the tip side of the finger. This specific lancet has a twist off cap, so we'll go ahead and twist that off, and the button here prompts it to eject the needle. So once you poke the finger, a small drop of blood will come out. You'll want to take your gauze and wipe off that first drop. Now, we're going to go ahead and collect the second drop of blood. You'll go ahead and squeeze. If you can't obtain enough blood, it's called milking the finger. And once you get to have a substantial amount of blood drop, you'll go ahead and, in our 5th step, take the test strip, and using gravity, it will allow the blood to be sucked up by the test strip, and it will load you a blood sugar reading. You'll want to use your gauze to go ahead and form it over the poked site to stop the bleeding, and you'll receive a blood sugar level. This specific blood sugar is 106. That typically falls in a great range, close to a perfect blood sugar reading. Now, it's very important to record your blood sugar readings, as we talked about earlier. That way we have a list of blood sugars to present to your provider upon any follow-up appointments, so they can really tailor your treatment. Now, do you have any questions on how to check your blood sugar? No? Okay. Well, using these supplies, since it is before breakfast and we've been directed to do so, please go ahead and check your blood sugar. And please demonstrate to me out loud what you will be doing before you do so. and let me know if you have any questions. Thank you.